one of the things I remember from the back doctor was he made a comment about my back brace because I was wearing a back brace so I could walk.
Sure.
And he said, that's great, but all that's doing is making you weaker. And I thought, wow, maybe. And I took it off that day and didn't wear it anymore. Welcome back to the Talk Midland podcast. My name is Logan Richetti with Modern Realty. Today I have my buddy Ryan Madigan, True Motion Chiropractic.
Thanks for having me.
Just moved into a new building.
I did.
What's the address?
5912 Eastman.
Prior to that, you were around the corner on East Wackerly.
West Wackerly, yeah.
West Wackerly.
Yeah, we're there for about 7 years. And we've been in this new location a couple months now. So very excited. Appreciate all your help. Yeah.
Well, I helped you buy it, but
absolutely,
you renovated it very nicely.
Absolutely. Thank you very much. I've got my wife to thank for a lot of that too, but had the vision and now it's come true. So,
well, if you're driving down Eastman, going north or south, you'll notice the building there. You painted the outside.
Correct.
So you whitewashed the brick.
Whitewashed the brick, and it's like a dark gray color.
And you pulled down a lot of the landscaping out front.
All landscaping, all brand new stone, all that type of stuff too. So,
I love exterior renovations of commercial buildings. It's so much fun to see what paint and some landscaping can do.
It was immensely helpful compared to what it was. So,
and you had another tenant in there that you moved next door.
Correct.
So who was that?
That's Saginaw Psychological Services. So they own the building, sold it to us, and then re-rented the other side. So,
okay. So you moved them into the smaller side, and now you're in the bigger side, which you did a full renovation on the inside. The front entrance is beautiful. The rooms are beautiful. You went top to bottom. I walked in there at your open house, and I laughed a little bit because I know it cost more than you thought it was going to cost.
As any project, yeah.
As any project worth doing, you got to overspend a little bit.
Absolutely, yep.
But now, what do you have in there? What's the layout? What do you offer? And what is the competitive advantage now?
So layout, brand new, pretty much everything. Carpet, ceiling, tile, paint. So it looks fantastic. We have chiropractic in there, what's called soft wave therapy. We can get into that a little bit later too, but which is awesome for chronic overuse injuries. We have 2 massage therapists in there. 2 excellent front desk people. Competitive advantage, I think we just make it very easy to be a patient. No pressure, sales tactics, a good, clean, welcoming environment, easy to get appointments, that type of stuff. We're there all the time working, trying to help people out. So it just makes it a good, easy environment for people to get the care that they deserve.
Well, I've been your client before. I am your client now, and I can attest to everything you just said. You make it very easy to schedule appointments. You're very flexible on short notice. Maybe that's just for me, but
we do our best to try and help everybody out. Working through lunch, do all that type of stuff. A, we're trying to grow a business, but B, we like helping people. If they're in a pinch, we don't want them going nights or days in a lot of pain. So we want to help them out as quick as possible, or at least get them in the right direction. So they're not hurting overnight or losing sleep or weekends, all that type of stuff. So we do our best to stay longer, work through lunch, help people out best we can.
I want to talk about therapies and treatments and whatnot, but first I want to talk about just a little bit my experience in both of your operations, because I've seen both now. The front entrance is so clean. It's so nicely put together. It's very inviting and attractive aesthetically. But it makes you certainly feel definitely at home in a small business like that when you walk in. And you're greeted with that kind of ambiance. So bravo there.
Thank you.
And the new place is even better, which is cool. And you own it, which is cool.
It's helpful. Yes, it is. Now we can start kind of expanding a little bit with no restrictions as far as that, which is good.
Well, that's the nice thing about buying your building. If you're a business owner versus renting it, obviously there's a lot more control. You have a lot more benefits of, depreciation and principal and all that stuff. Yep. But also it costs more, and you got to make capital investments, and that could be risky and scary, and you got to bet on yourself and on your business and on your community to continue to support you. But moving from Eastman, which was a good high traffic corridor, over to Eastman,
correct,
is going to do nothing but help you.
Yes. We got a lot of eyes on it, and we have very good local established businesses around us too. Midland Eye Care, Glow Skin Spa. We get a lot of eyes on our building already, just from patients that are already out and about, dentists next door, that type of stuff that are out and about, and know way higher traffic, parking lot, all that type of stuff too. That's why having the aesthetics outside was helpful too.
All right, let's talk about chiropractic in general, specifically with cracking necks and cracking backs to start, because I have a lot of questions.
Sure.
I don't love it putting other people's hands on my body and doing things. I let them, because I'm in chronic pain all the time.
Sure.
But I don't, like, you'll notice you and I have never done a real back or a neck crack of any significance in any of our our meetings. And so partly because I worry about something bad happening,
Sure.
One bad crack or whatever, and you're hurt. But how valid is that concern, or is it just somebody doesn't really understand that it's not a big deal?
So it's a valid concern. Anytime anybody has a concern, we take it seriously. As far as that, as far as something bad happening, it would take a lot of force for that to happen. But in our exams, we do our best to parse out negative red flags as far as that. Previous injury, chronicity of injury, blood pressure issues, vascular issues, that type of stuff too. So we do our best to screen everything out, and then we are very judicious in our neck adjustments too. It is not a requirement to be a patient in our office to get your neck adjustment or neck adjusted, but we do our best to screen everybody the best we can, take a very thorough history on that, and then really be judicious with our use of it and stuff like that too, and be is least invasive as possible to the most invasive, which is the adjustment. We are on the side of doing exercises, therapies, all that type of stuff. If people want the neck adjustment, then we move to that. Well, we take x-rays, all that type of stuff too. Is all part of our exam and history to try and parse out any negative reactions.
All right, let's go through the client life cycle a little bit. Somebody calls in, they say, I need to come in for an appointment. The first time they come in, you're doing a consultation to ask them what their pains are, what their issues, pain points are. Are you, on that first visit, are you doing x-rays on the first visit? Is that typical?
Sure, that's pretty typical. That's not for everybody. Like I said, we do intake forms. We take a very thorough history where we're spending at least an hour with patients, really trying to get down to what's going on. In our paperwork, a lot of that is parsed out too. Not everybody gets x-rays. If you're young, no injuries, that type of stuff, we do what we call trial of care. If not, if we don't get anywhere with that, then we'll refer you for x-rays as far as that. Some people have trauma right away. Car accidents, falls. We've seen some wild things where you wouldn't think stuff would be going on. We refer them from x-rays and find that too. So we refer that to the Orchard building at Mid-Michigan. It's a very quick and easy process. The good thing about that is they have excellent facilities. Get a radiologist, medical doctor to read it, and then we get a copy and then we go over it with the patients too. So.
All right, the first time I came in, we were talking about my back injury,
Sure.
I think, and I have some bulge discs,
Sure.
is what we found out. That's why I'm humped over right now.
Sure.
But you mentioned the MRI was kind of the gold standard.
Correct.
Why is that? What do you get to see on the MRI that you don't see on an x-ray, and why is that so valuable?
So soft tissue and nerve, what the nerve is involved. So x-ray, you're just going to see basically what the bone and ligaments are doing, if there's any calcification, degenerative change. So you're basically strictly seeing bone, minimal soft tissue, where the MRI is going to see bone, nerve, if there's any fluid accumulated due to injury, see what the soft tissue is doing, disc, ligament, all that type of stuff too. So you get a complete whole picture. Yes, it is a little bit more expensive, but in our case, we want to see what the discs are doing in there. If there's any tearing in there, if there's any bulging, you cannot see that on an x-ray too. So you can have an idea, a clinical estimation, but to get right down to the true what's happening, MRI is gold standard with that.
Well, so that's how it went with us.
Sure.
I came in, I was complaining of back problems, and I was describing what they were, and you had a pretty good inkling of what it was, and you were right, obviously, but I went down to get the x-ray or the MRIs. You came in and read them. They mailed them to you, or they emailed them to you, or
Yep.
a disc or something. And then, so you've identified that the patient has bulge discs, which is when, I guess, some fluid in between the discs is disrupted or something, the tissue is. How do you approach a case like that? What kind of things do you do? Now, obviously, you connected with my personal trainer, Adam.
Sure.
And you guys consulted a lot, which I thought was amazing.
Yep.
But in terms of treatment and applying some relief to this area in the long term and short term, how do you approach that?
So first of all, we want to make sure that you're a good candidate for care in our office, conservative care. Sometimes when people have disc injuries and stuff, they have what's called neurological involvement, where the nerve is compressed to such a high degree, it is basically cutting off nerve function to certain areas. That is a more invasive procedure that needs, so that is immediate referral. We do that. So that's our first thing, is we make sure that you're a candidate for care.
So if that's the case, you're getting a referral for surgery?
Not necessarily. Refer it to their primary doctors, and then they take a visit to a neurosurgeon, and that's their scope of practice. They're the experts on that type of stuff. So that's their call to make that. But when there's neurological involvement, we typically make a referral as far as that. So what our main goal is, are you a candidate for care? Can we help you? That's the other part of it too. Where is your pain level? Is it excruciating? Do we need to get you a pharmaceutical intervention to try and get some inflammation down? So our care can help you a whole lot too. So that's our main goal, is to try and make sure you're a great candidate for care, and we can treat you safely without further harm.
So you can make referrals to prefer prescriptions.
Yes, so that'd be your primary doctor. So we either do that or refer to urgent care, that type of stuff. So I cannot write them, but we facilitate. Okay. Hey, I think you need to call your primary doctor, and then they gatekeep where that would go, orthopedic surgeon or a neurosurgeon or something like that. After that, then we basically onboard you as a patient. What is your pain level? Can you tolerate an adjustment? Would therapies be better, a little bit more hands off? Exercises, treatments in the office, cold laser therapy that we offer, soft wave therapy. Would that help better than typical chiropractic adjustments too? So we see quite a bit. We see results with both, but that is just more of a clinical judgment call in there too. And then patient tolerance level, because a lot of people that come in like that are in excruciating pain.
So talk about the red light. What is it called? The
so
laser?
It's called a cold laser. So basically what it uses is a bright red light to penetrate deeply to try and bring blood flow into the area to try and help it heal faster. It's very well researched. Every pro sports team on planet Earth has one too. But the adjustment is going to be for getting range of motion into the joints, which doesn't always attack inflammation right away. So naturally we go in with that red light, the laser, and try and get inflammation down and swelling down right away so it's tolerable for people. Right away to get them out of their immediate pain, because a lot of time it's excruciating. So we're trying to bring them down the pain scale so we can actually get down to work.
All right. So once you get the pain under control, which all these things are, we did this. I had a referral to a back doctor, and he got me a referral for some I think it was some kind of steroid.
Yep, a steroid injection, or they do a steroid oral dose pack. With
it was
that
an
too.
oral. If you said the name, I'd recognize it, but
There's
it wrecked my stomach. It was really tough.
It's not, yeah. So there is caveats to each of those. There's risk to each, not doing that. And then there's interventions to that, risk to that, but it can also be extremely helpful. Is trying to get you out of pain and help you sleep, where we naturally heal a little bit too. So there's just many different ways to go about it. It's just a matter of patient tolerance, getting over their fears, trying to help them through their fears, and then what they can kind of tolerate with that.
All right. So a lot of this, the beginning stage of the treatment is pain reduction, inflammation reduction,
Correct.
Getting you to a point where you're not in pain all the time,
Sure.
wincing in pain and whatnot. So that also gives you a couple days to recover, to try not to do any pickleball or anything stupid.
Correct. And just recover. Yeah. We always want people to do what we call an active recovery. So if you're into a huge heavy weightlifting, that type of stuff, we want you to be active and moving, but it may not be underweight or stuff like that. Walking is incredibly helpful to fix or help these injuries, pushes blood flow, helps inflammation down, keeps you on your feet. Swimming, just that type of stuff. So we always want you to be active, but it may not look like the exact exercise that you be doing that either injured you or you had an injury and you can't do. So we want you to actively heal.
One of the things I remember from the back doctor was he made a comment about my back brace, because I was wearing a back brace so I could walk.
Sure.
And he said, that's great, but all that's doing is making you weaker. And I thought, wow, maybe. And I took it off that day and didn't wear it anymore.
Sure. Sure. So there is some validity to that if you wear it long term.
Yeah.
If you have a high labor job or heavy lifting, shoveling, bricklaying, anything like that, plumbing, electrical, where you're in contorted positions, the back brace can be a lifesaver to help you work. You have to earn a living. We can't put you in a bubble. You have to go out and do that stuff, produce for your family, friends, all that type of stuff. So the back brace can be immediately helpful. But if you were to wear that all day long and for days at a time, it can decondition the muscles and make them a little bit weaker, which can put more stress on your spine. So it has to be used judiciously.
All right, let's go back into the office now
Sure.
for treatment. So what are we doing first?
So we're doing an exam consult, and then if you're a candidate for care, we get x-rays, do through all that. Then we make our clinical decision. Are we doing adjustments? Are we doing the laser? Are we doing the soft wave machine? All the above, massage, all that type of stuff. So
Let's talk about adjustments first.
Sure.
So what does that look like? And I've done a couple. I know what it looks
Sure.
like for me, but what's a standard set of adjustments for a new patient like this?
So a standard set of adjustment is called diversified technique, which is basically pretty much the most common adjusting, where we're adjusting pelvis, sacrum, lumbar spine, middle back, and if warranted or wanted, neck adjustments. But we also go down. That is a little bit more invasive, where the pushing and where you hear the pops. Down the road, what we also have in the office is called activator technique, which is an instrument handheld. And then we also have what's called the Pulsar machine, which uses a computer. Basically, we use a probe. It goes down people's spine, and it says like, hey, this joint's a little more fixed than the one above or below. kind of uses technology computer. I go back, palpate that, and it uses a vibratory percussion to adjust the people instead of the pushing down and popping, so to speak, as far as that. So we have a wide variety of options to adjust people from younger kids all the way up to athletes, and then into geriatric population too, where it's nice and safe for all populations to get chiropractic care.
So that's on a table?
So yes, a lot of this is laying down on our table. We have a pneumatic table that does popping up, down, through adjustments and stuff, and then our other techniques are on the tables too. So
would you? I've never done that before. Would you describe that similar to like a massage chair where it pushes different parts of you?
Nope. So basically, it's a probe that goes down in your spine, and then it uses a vibration to try and get better range of motion in the joint without the thrusting and pushing down too.
What do you mean by probe?
So it's a handheld device that goes down, and it's basically pronged just like this, and we scan each vertebra.
Yeah.
And then it says, hey, we got a lot of I look on the computer and it says, hey, this is stiff. It shoots a vibration in there and it goes, hey, this is stiff. Takes down, and it notes muscle tension, how the joint tension. Then it goes, hey, of all the vertebrae we scan, these ones are the most stuck. And I go, hey, that's kind of correlating with their symptoms. And then I do my own palpation with that too. Then we go to an adjustment mode on that, and then it shoots a vibration into there a little bit with a little higher force to try and get range of motion up and inflammation down a little bit in those areas, muscle tension down too.
So do you get a report that shows red and green?
Yeah, it pops right up. Yeah, so it shows red and green. These areas are stuck and fixed. And then we kind of do an after scan too to, hey, did we actually do something? Or is it still inflamed due to muscle tension, nerve irritation, all that type of stuff? So we do our own set of checks along with the computer too.
So you can do a before and after with the computer, and then the treatment, and then the computer again.
Correct.
And you can see an actual tangible difference. Right
Yeah, comparatively, it goes compared to the pre and post scan. Yep.
Does it have to do with the location of the vertebrae?
Yeah. So each vertebra scans C1 to L5, and then in your tailbone, which is called your sacrum, it scans all that too. So and it compares to what it was before, after or pre-adjustment and post-adjustment.
All right. So when I lay on the floor and somebody steps on my back and cracks it up all the way up and down, what's happening?
So gas is escaping the joint. So when you hear those pops a little bit, so when you put a thrust in the joint similar to your knuckle, that is just hydrogen gas escaping that joint. It does feel good in the meantime, but you are kind of popping multiple joints, some of which may need it, some of which may not. As far as that, and then you're using a lot of force if someone's stepping on you, doing all that type of stuff. So when we're adjusting people, the kind of pop that or crack that people are we're synonymous for or looking for is gas escaping the joints. When we press on it, the joint will shift and creating that pop in that joint a little bit. What that does creates better range of motion, signals to your body to kind of, hey, calm down a little bit, it reduces muscle tension, and then in turn hopefully reduces pain down the road.
Well, okay, so if I just cracked my neck.
Yep.
Did I just put my neck into a better position?
I can't say that it's that would happen doing that, but it's gonna create a tangible effect of feeling a little bit better, taking stress out of that joint that may be there where you feel like you need to do that. So it can give you minor effects, feeling, hey, I feel a little more loose doing that, but saying that it put it into a better position. Usually, what happens when you do that is the joints above and below what need to be adjusted are moving, because that joint's so stuck above and below moves that a little bit. So
is that good or bad?
I would say it's not. You can have a good feeling with it, but doing it long term, it's just like any other joint. It honestly can make it feel a little bit worse. If you're doing it all day, twisting and popping, it can stress those joints and cause it a little bit more irritation than you already felt to begin with too. So that's why we recommend seeing a chiropractor, whether it's adjustments, but you can also get assessments too. Like, hey, I think instead of popping, I could give you 2 or 3 exercises you could do at your desk that would stretch the muscle out, help the joint, help your posture, instead of just getting that immediate little bit of a pop. So I like giving people exercises to do at their desk for a long-term solution for that. And it's a little bit more easier on your body doing that.
Well, when I was in high school, I had a buddy, his dad told me that if I keep cracking my fingers, that I'd have arthritis by the time I'm 40.
Yeah.
41, sir.
Sure.
You got it.
Yes.
Is that an old wives' tale or is that a real thing?
I would guess, compared to the research, I don't think it says that you're going to get more arthritis doing that. What we find is people that do it chronically either they get more pain. Like I said, they're irritating those joints because they're twisting their neck 10 ways to Sunday, or they're getting what's called hypermobility in the neck, meaning too much movement, which can cause irritation too. So stretches the ligaments, irritates the tissues around it. So we always say leave it to the kind of the pros to do that type of stuff, or get some exercises to do to try and do that. But I don't think it's going to cause any more arthritis in there too. It just might irritate arthritis that you already have.
Where does arthritis come from?
So itis at the end of that word is inflammation of the joint. So a lot of it can be overuse injury. Your body lays down, tries to heal injuries fast. Okay, so kind of analogy I use in the office is you've seen people potholes in the road. They go and lay that stuff in there. It keeps you from blowing your tire out, but it doesn't look like the original road. Same thing kind of happens to our body. We injure it, whether it be a car accident, whiplash, sports injuries like yourself. Our body tries to heal that really fast, and it doesn't always look like our original tissue. That's where we get the arthritis, the bone spurring, that type of stuff, the degenerative change in there. So it comes a lot from overuse. We're seeing a lot of studies too, and we're correlating a lot is to diet, non-exercise, people that aren't exercising, that type of stuff. High insulin, blood sugar issues can cause advanced, rapid degenerative in some joints. And I in our practice, we see that quite a bit. And we ask people their sleep schedules, all that stuff. So we are one component of health, but we also check into other stuff too. So long story short, that's why I think where that kind of comes from is either overuse, poor diet, nutrition.
Sugar?
Sugar, yep, exactly. I think that adds fuel to that fire a little bit. Also, they put us at desks at 5 years old, and we're slunched, humped over, doing schoolwork and stuff all the way through high school or college, wherever, or further, and that adds to that a little bit. So I think a whole host of stuff can do that, but a lot of stuff that we see in our day-to-day is overuse, work injury, or trauma. They slip, fall, injure themselves at the gym, that type of stuff too. So that's what we see on a day-to-day.
So probably safe to say that if I keep eating Oreos every night, my inflammation is going to last longer?
Yeah, so it's going to exacerbate what you already have going on too. So we're looking to try and get that under control, A1C, blood sugar. That is for the medical professionals to do that, but we always have them check in with their doctors, make sure all that's good, because that does contribute to degenerative change and just pain in general, overall inflammation. So yes, I think it'd be adding fuel to the fire of previous injury, and I think that's what we see a lot of, and why diet and exercise is so important is to offset kind of the damage we do in our day-to-day life or slow it down a little bit.
You recently put together a hurricane relief fund.
Sure. Yeah.
For a hurricane down in North Carolina.
Yes. That was awesome. That was my wife's brainchild. We were in the middle of move and remodel, and she says we have to do something. Her aunt lives down in Hendersonville, which is just outside of Asheville. Luckily, they were very high up, so their house didn't. But Asheville's down lower in the mountains, and it was devastating down there. So we tried to do the best we possibly could for that. In our old office, we had 3 big treatment rooms, and we filled that. So we filled a 16-foot rider truck full of stuff to try and help those people down there. And then we had 2 family friends that were retired and graciously had a little guide trip down there, and they drove it all the way down, stayed in hotels a little bit, and dropped it off to a local church down there where they kind of checkpoint stuff to hand out what people need. We had food, toilet paper, clothes, all that type of stuff too. So that was fantastic. My wife's great idea with that, and it worked out very well.
That's a pretty sweet thing to do.
Yes, it worked out very well. I'm glad we could do it. I was in my own little world with our renovation stuff, and she just brought it down to reality. And then her aunt being down there too, it really put it into perspective, because they were grilling their drinking water. You know what I mean? And propane, that type of stuff. They had nothing as far as that, no electricity and stuff. So if we could get some water down there and try and help them. And like I said, it was a big amount of stuff. We had 3 rooms full of stuff. It was awesome. So it worked out very well, and they appreciate it very much, and tried to do our small part, I guess we'll say.
All right, back to business. So
sure.
You have 2 massage therapists
we do.
in the building?
We do. Yes, they're both fantastic. So they range from light touch to all the way to deep tissue. Both of them, what I say is they can bend steel if they need. They're excellent at what they do. What they're really trying to do in our office, what we see, we can do relaxation massages. They're very capable of that, but we see a lot of injury in our office too. So where we're going to handle the mobility and structural of the joint, we send them to work on the muscle, try and get kind of those knots a little bit. All that muscle attaches to the bone, so if that's tight, it can irritate tissues and not help you have great range of motion along with that. So they're honestly the stars of the show. Everybody loves them. They're fantastic. They do great work. I've used them myself, but they're full all the time, months out in advance. So they do excellent work, and they make our patients feel at home. They get to disappear from the world for a little bit and have a place of solitude. And they do a very, very good job for us.
So a lot of those clients are coming in for chiropractic work, and then they move next into or in conjunction with the massage therapy?
Exactly. So a lot of them are in conjunction. So we're seeing that. Or they graduate chiropractic care. They're like, hey, I feel great. And they want to continue doing that type of stuff, which is awesome. Because not only is it helpful for pain, mental stress, mental health, like I said, they get to disappear from the world. Kids, life stresses, work, all that type of stuff. We want to be a place where they can do that. You know what I mean? So it helps them benefit, even if they're in a lot of pain, they can kind of relax and de-stress a little bit. It's immensely helpful for their care.
A lot of our appointments are very short and quick.
Sure.
Is that normal?
Yeah. So it just kind of depends. You and I know each other pretty well. You're a busy guy, so am I. So we get down to business a little bit. What a lot of people can expect is some want quick appointments. They're in and out business professionals, or they want a little bit longer of an appointment, and that we do. So we kind of read the patient, know exactly what they want. We can accommodate them. Everybody's on a 15 to 20 minute schedule. We don't overbook. That way we don't have a massive overlap where we get rushing and stuff like that too. We always try and be present with the patient, but there are patients that are down to business, and then there's other patients where we chat a little bit too and have a little bit more concern or a little bit more nuance too. So some are quick and some are in that 15, 20 minute range as far as that, or they can be a little bit longer if they're doing massage, or we need to do exercises or different forms of treatment with that too. So wide variety.
What's the biggest challenge you face trying to build a small business in Midland?
In Midland, Midland's been an awesome community as far as that. More of it's just name recognition, getting the name out a little bit too, as far as that. Just building marketing, I guess we'll say, as far as that. I think we've done a fairly good job at that, but at the start, when budget's low, you're trying to do it on a shoestring budget. It does hinder your growth a little bit. Global pandemics don't help a whole lot as far as that goes. We navigated through that and thought we did a good job through that type of stuff, and now are poised for a lot of even more growth than we're having to. But I would say that's the biggest challenge, is getting our name out there a little bit and just trying to differentiate ourselves from. There's quite a few chiros in Midland too, but there's a lot of people out there that need help. So we try and find our good niche and of who we vibe with and that love our style. You know what I mean? We're very, I'd say homey, I guess we'll say. Our patients turn into friends, which is awesome. Some, like I said, come and go. But there are some that we really love having in there. We love having everybody, but we really vibe with that to try and make a good family atmosphere in there too. So
what's next for True Motion Chiropractic?
What's next is growing our staff. We have a possible another massage therapist starting here soon. And then we're looking for more doctors down the road too. So I'm in a good problem to have, but at my close to my capacity. And then trying to get a little bit better schedule as far as that, to open up for more patients too. So a little bit more help for myself, a little bit more staff, support staff, I guess we'll say too. So really trying to find the right person for that. We have our front desks are phenomenal. So if we add to that, we're trying people that just fit in with that and have our values and just really love on people and respect people as far as that goes. So we're on the lookout for a new doctor to try and expand and help Midland not only, but the Great Lakes Bay region.
All right. So if you're out there listening, we're looking for some admin help.
Sure.
Another massage therapist or two, and then a chiropractor.
Yes. Okay. So we're in talks with a few to try and do that. Logistics are a portion of that type of stuff, but
sure.
I think we have one on the horizon that's going to be fantastic. So very excited about that, and will be a huge asset to the Midland community.
What's the best way to schedule an appointment?
Scheduling appointment is going to be calling us directly, 989-495-2332. Facebook, Instagram. Even if you don't get us on the first couple rings, that's going to my personal cell phone. I kick it to our sports staff, whether it be emails or anything like that. A lot of it you will find I'm answering the phone too. My first boss, we were a very busy office, and he answered the phone too, so that really rang true to me. Always be of service, really just be available for people to try and help as far as that. So sometimes you'll get me if my staff's on the phone or on the other side. We do our best to always answer the phone. I'll get back to you within a couple hours.
Ryan, thanks for being on the Talk Midland podcast.
Absolutely, Logan. Thank you very much for having me.